Tonight we revisit and go forward with a story that is absolutely ridiculous.
The Dan York State of Mind program is brought to you in part by Lookout Rhode Island and Takeo Comfort Solutions.
Ridiculous in the sense that this should never have happened, but hey, you know what? Sometimes good things happen from bad breaks, and there's a project going on right now that you could help to contribute to, and it's all part of the life story of Dr. Khaled Almilaji, who got jammed up in the travel ban. Nice to have you aboard. On Friday nights, we rid ourselves of the rundown. Don't tell anybody, but we record these shows a day in advance on Friday as part of our nightly effort here. And it gives us a chance to kind of expand on a longer theme or tell you a story. And tonight we're going to kind of revisit the other half, the American joke would be the better half of the story here with the main character's wife, because the main character isn't here. He's in Turkey, and we've spoken with him on the radio on a number of occasions. We first met him here when we were talking about this really cool cooperative program that's going on at Brown University in the medical world. Here's the headline that may have captured your attention, and maybe you're following this. Love interrupted. If I had my glasses the correct way, I could read the rest of the headline, but I can't, so I thought I knew what it said. But here is a conversation I had with Dr. Almilaji, who came to Brown University to pursue a postgraduate degree and to share in this really cool program that they have, and the head of the program would be here tonight to explain it. Then he went back to Turkey for a little break during the holidays, and guess what? The travel ban, even pre-inauguration for Donald Trump, preempted him, or this is the murky waters. We're not exactly sure what preempted him from coming back, other than his visa being revoked. We spoke to him on the phone a little while ago.
Unfortunately, now she's there, I'm here, we are lost. We cannot take like a direct decision that should we wait till I get a new visa, or should she like come back here, or what? So it's a little bit of dilemma.
All right, so the gentleman on my right on that screen, but your left on the television, is our main character in Turkey, Khaled Almilaji. And Dr. Cihan Mouhsen is our guest. She is his wife. You're stuck here. You feel stuck?
Sort of.
Sort of. Well, welcome to the show. We were impressed by your husband when he first came here to talk about the program. Seemed cool, pedestrian to me in the sense that there wasn't really much controversy. He takes a little trip back to what, tidy up some family affairs in Turkey, where you both came from.
Yes.
You thought he was going to go, what, for a week or so?
Yes. His trip was exactly 6 days, from January 1st till January 6th. He was supposed to be here. He was informed 2 days later, on January 8th, actually, because the airport was closed due to the heavy storms in Turkey. So he was informed at the airport that actually he cannot leave because his visa was revoked. He cannot come back to the United States.
And thus started the entire what the heck happened.
Yes.
What the heck happened?
Who knows? I want an answer. We want an answer. We both want an answer. Because we've been through extreme vetting to get the visa in the first place. Khaled is a big and known humanitarian worker in Turkey and in Syria. So it took us, like, we were the last people on the list to get the visa in the first place. I don't know why, but we were so happy and glad, and Brown was wonderful.
Are you studying at Brown as well?
No, no, I'm just a physician who was trying to get a residency, who was trying to pass the exams for the USMLE to get a residency here in the States.
Was the plan for you to stay here?
No, the plan was Khaled to get his degree and I see what I can accomplish. So we came here just for education, and then we can get back quickly to our country.
Just so you understand, and go to foxprovidence.com. In fact, next segment will tell you what the date is. It dawns on me that we need to do that. And you can see the original show as he talks about, the plight of Syria and the incredible humanitarian work that not only he, of course, but an incredible medical and volunteer community are involved in. And all you got to do is do a little time studying the chemical attack environment there and just the overall plight that the Syrian people have, and you realize what kind of yeoman's work he and so many others are doing. He was sharing some of his expertise, and as well as getting his postgraduate degree here. It's part of the neat program that Brown had going on. But I recall he was telling me that he was going to go back with some of that expertise, correct? And do some great work.
Of course. So the point is just to get educated and leave and get back to help the people to be of more weight, because it's different when you have these 3-letter MPH behind your name than just like NMD. When talking to people and talking to donors, when you want to help the Syrian people, people will listen more. And if you're graduated from Brown, that's a big thing.
All right. You're both young people, both doctors.
Yeah.
What is your specialty?
No, I'm just a general practitioner.
Okay.
Trying to get a specialty.
Right.
Yeah.
And you're also now with child. Congratulations.
Thank you very much.
Which only brings a little bit more stress to the situation. You haven't seen your husband now since January. It's now 5 months, 4 or 5 months. There was some talk of you heading to Canada, and maybe he could get a visa to get into Canada. Is that part of the plan?
Well, since he lost this semester and it's been taking so long, so you have to like try to find a plan B. So the plan B maybe is Canada. Maybe we'll have better luck going to Canada. So
to do what? To pursue
yes,
an additional degree as well?
Yeah, so he can finish actually what he started in here, because if he comes back, we're not sure if we're going to be able to leave the country for now, and it feels stuck.
I'm going to ask some of the Brown people here coming up in a minute what they've been able to do to get some traction for your husband to get back here. But what have you learned about the climate here based on this experience?
Well, I have the most wonderful impression of the people, of Brown, the people of the United States. Everybody I've met so far was very supportive, welcoming, helping. They all jumped in. The people at Brown tried and still trying for Khaled to get his visa back. But it's like up to the embassy, and we're still waiting. But for the people and everybody else, so I have just a great impression of the whole country.
In the meantime, while all this is going on, a new project has kind of come on board here.
Yes.
Tease me on that before we explore it in the next segment. Did this happen as a result of him being stuck over there, or is this something he had in his mind the entire time?
No, it's something that started last year, actually. Started at the beginning of last year. So I, as a pregnant woman, cannot think of what other pregnant women are going through in Syria. So we thought, because of the pregnant women and children in Syria are been like left behind a little bit unintentionally because of the huge number of the trauma patients. So he came up with an idea that these people are more vulnerable, so he wanted to focus on helping them. So he started his project last year, working on this.
And the project is he wants to build
underground.
an underground hospital.
Yes, for women and children.
The sickening aspect of this is that he and others have got to plot to build a hospital underground so that it's less susceptible to the attacks, both on the ground and from the air, correct?
Yes, exactly. It is going to be a huge opportunity for the doctors who are already Syrian living in Turkey, but they're afraid for their lives to come back. They are willing to come back and work underground because it gives them more security. They're really looking forward for this hospital to finish so they can get back and help the people.
All right, when we come back, we'll talk to the guy that's running the program at Brown, and also another participant who's going to plead for our help in this. Stay with us.
Crossed a lot of lines for me. When you kill innocent children, innocent babies, little babies, with a chemical gas that is so lethal, people were shocked to hear what gas it was.
You know, it's I don't know. You have to be able to have a common ground and relate to Donald Trump's emotional reaction to this. But I wonder, we're going to introduce Adam in just a second, but did you kind of smirk over the idea that he's just kind of coming around to what the reality is over there in Syria? I mean, I do. I mean, you take a look at some of the documentaries that come out of there, and it will cause multiple sleepless nights if you have a soul and a conscience. Yes?
Yes.
You've seen it. It's brutal.
I know.
Nothing,
it's been happening
nothing
for a
that
while.
we would even understand here, correct? Cities that were vibrant, like Providence, are now, what? Decimated.
Yes.
Dr. Levine is back. Welcome. Good to see you.
Thank you.
You know, who would have known that when I first met you months ago with Dr. Almilaji, and we talked about this wonderful cooperative program you got going at Brown, that you'd end up back here talking about him being stuck, you know, being embroiled in what really is an international dynamic. I don't know if it's reached international controversy. I am quite shocked, by the way, that national networks haven't picked this story up. Because this is not just a travel ban thing. This happened beforehand.
Right.
There's a whole bunch of mystery surrounding this whole thing, don't you think?
I mean, Khaled is a perfect example of a physician, a humanitarian, a good person who has now been blocked from entering our country, like so many other Syrian refugees and others who want to come here and gain educational opportunities and go back and help. And it's really, really unfortunate that we've been so close-minded.
Rewind for just a second why we originally met. What is going on? The program at Brown does what?
So last year we launched our Humanitarian Innovation Initiative at Brown University within the Watson Institute of International Public Affairs there. And I think we had a chance to chat a little bit about it just after we launched. And the point of bringing Khaled on as well was to talk really about how the goal of the program was about building local capacity in the areas most affected by crisis to better care for patients, for people who were displaced, for people who were suffering from the violence and from the conflict. And so Syria is a perfect example. Khaled is a physician from Syria. He's worked there, and the Humanitarian Innovation Initiative allows us to partner with people like him in order to build up capacity to do better for the people suffering from the conflict there.
And at the time we talked about it not being the typical pursuit of degree, that there's a lot of mutual intel on this category of learning that was going on back and forth, correct?
Absolutely. So with Khaled, just like with our other 25 or so international fellows from around the world, it's all about mutual learning from each other. So we can give specific skills and maybe teaching a little bit about specific ways of delivering aid or specific ways of measuring need. And he teaches us a tremendous amount about the actual context and about what it's like being in Syria and trying to deliver aid in that setting.
So while you were here accompanying your husband in his studies here, what was he telling you about what he was gaining here in at least his first semester at Brown?
He was super excited, super busy working and studying, and he was like, wow, this is all I wanted to do for a long time. But
meaning what? What was he gaining?
Like all the knowledge from books that he has only as his own ideas or what he thinks as his intuition as a physician to do, he now found it here in books and like all documented, and actually it spread his views, and like he had much more ideas now about what he was doing and what was maybe more right than what he thought is. So I don't know, he was like so happy about it.
Any insight as to what he was gaining in terms of perspective?
Absolutely. So he was gaining specific skills, for instance, in public health, such as how you measure need in a setting of disaster, how you assess what the needs are for a population. And he was also making connections with the variety of faculty at Brown, from our School of Engineering and Computer Science, people who can help him with things like designing new apps or tools for use in the field to be able to measure need for the populations there. He was working actually on a project to design a whole health management information system for the people of Syria as well, to keep track of all the different cases that were coming into different hospitals.
And what were you getting from him?
And what we were getting from him was knowledge that cannot be gotten in any other way than firsthand experience on the ground. His work in terms of caring for displaced people in Syria, refugees in Turkey, is invaluable in teaching us what the actual practical side of things in that work is. I've spent a lot of time doing humanitarian work in places like West Africa, in South Asia, etc. I've never worked personally in Syria, and every single humanitarian emergency is different. And so you need that local context to be able to learn from it and know how best to respond.
So this project to build this underground hospital is underway. I know that you guys want to support that. We'll talk more about that in our next segment. How are you holding up?
I'm okay.
You look like you got your act together. You're composed and very high level, professional right now. But you've had some awful days and nights here.
Yeah, of course. I mean, it was bad. The first trimester was hard, and being alone makes you feel like it actually made me more realize more like how awful is it for the women in my country, like being alone in a country where I have everything that I need, and being alone or pregnant in a country where you don't have anything and actually you're being bombed and shelled. It makes you just it's depressing, but still okay.
You talk to them every day, or
yeah,
in
course.
Turkey, right?
Every day.
At least the technology, did you do the FaceTime thing and all that kind of thing?
Yeah, like Skype.
Yeah, Skype, yeah, whatever. There you go, there you are, in action, doing your thing. I only say whatever because I don't know what the hell I'm doing between FaceTime and Skype. I had FaceTime pop up on my new iMac today. Where did that come from? Oh, I clicked on well, listen, we wish you the best of luck. I'm sorry you're going through this. Right? Don't you just feel like you, as an American, don't you want to apologize for this? I do.
Absolutely.
Especially because we don't have the answers, right? We'll talk more about that as we go. Stay in touch. Best to you. Hopefully it all turns out okay.
Thank you very
good luck
much.
with the baby as
Thank
well.
you.
All right,
Thank
when
you
we come back, we'll meet a fellow medical student who's helping in the cause to try to generate some help for this project that Dr. Almilaji is working on. Stay with us. So again, the story has been about the gentleman that's on my right, your left there, Dr. Khaled Almilaji, who is stuck in Syria, but who I'm sure will be able to watch himself being talked about online at foxprovidence.com. The world has become a closer place, even though he's so many thousands of miles away. He was studying at Brown University with this incredible innovation project that was going on, and he was there, along with Dr. Levine here, talking about the program months ago. He got jammed up after a 6-day, I'm going to go back to Turkey and work on some things, family business. His visa was swiped away. We still don't know why that is the case. If you missed part of the program, you missed his wife, who was incredibly poised and a doctor, a true professional. You can see that on foxprovidence.com. Joining Dr. Levine here is Melissa Godfrey, who is a nurse and a classmate at the Brown University School of Public Health. Welcome.
Thank you.
You're affected by this because of what?
Well, so I met Khaled in class, and we became good friends, and when I heard his visa got revoked, I was part of the mission trying to get him back to Brown. We ran a petition, we've talked to many state members, and since that's at a standstill, Khaled said, well, let's use your power to keep going. And he told me about this hospital he's opening for the women and children that are still in Syria, in rebel-held areas, seeking care that don't have access. As a nurse, I always feel compassion and dedication to assuring people are able to receive the health care that is necessary for them, and so it instantly drew me in.
The headline there kind of tells the story. The Brown Daily Herald headline as the momentum builds to try to help this thing out. We have any idea what the projected expense is in building this thing and what his goals are? What is it?
Yeah, so right now we are at about 75% at our funding limit. We still need about $750,000 more to finish the reconstruction of the hospital and to furnish and get medical supplies for the hospital. And then the projected amount of running the facility for 1 year is $1.2 million.
Can I ask a stupid question here? It must be incredibly, and I probably should have asked our previous guest this question as well. With all that I've seen, maybe my perspective has become a little warped because of all the disaster that you see there in Syria and the attacks and the Russians bombing the Russians are bombing, okay? Never mind chemical attacks on the ground. To build a new facility like this and to raise all this money, are you getting any pushback from people who say, why, you're going to build this facility only have it blowed up later? I mean, Do you guys talk about that dynamic?
Yeah, I think that's a huge concern, naturally. In April alone, they saw more than 5 hospital attacks. And so this is one of the biggest concerns. But right now, this hospital is so important and key because there's 2 floors underground. This is new to the hospital healthcare system in Syria. And so there will be 2 floors designated underground to having operating rooms specifically for pediatrics and maternal care. And then above ground, there's 6 floors, which are kind of a decoy for bombardment. We're also hoping...
Think about that.
Yeah.
And it's a really horrific situation. We've seen some of the greatest violations of international humanitarian law with the bombing of hospitals in Syria. But at the same time, the people of Syria, the women and children especially, need options. They need places to go for medical care. And the doctors and nurses who want to care for them, they need a safe facility to do it in. And that's what's key about this hospital, is it's going to be an underground facility. And part of the expense of it is reinforcing it so that it is safe from bombardment underground.
And it's what? Is it safe to talk about the location? It's some 40, 50 miles away from the most recent chemical attacks, as I understand, correct?
Yeah, we're not right now giving up the exact coordinates.
I understand why.
Although the goal would be that eventually a hospital can't be hidden forever. It's 6 floors high, so we're hoping to give coordinates to Russia and others to safeguard this coordinate and make sure that they're not specifically attacked.
Does the intel tell you that that's going to be constructive? Russia's going to say, okay, we'll skip that spot. What about the regime? That's a whole nother ballgame.
Yeah.
You have no coordination with them.
Can't plan for everything, but I think that's why we're trying to set the system that underground is as safe as possible.
Okay.
Yeah. Well, and again, that's the idea. Even if people know that it's there, it's going to be reinforced so that it's safe from most types of bombing that the Syrian government would be able to do. At the same time, this facility is going to take a lot of effort and work to run, partly because of the fact that so many doctors and nurses and specialists have fled the country. And so part of it is providing a safe place for local doctors and nurses to work in. Another part of it is going to be training for those doctors and nurses to be able to care for the special needs of mothers and children, which they may not be specialists in. And so that's part of what we're going to be doing with the Humanitarian Innovation Initiative, is helping with that training through our partnership. Who
knew when you decided to pursue more study at Brown that you'd run into something like this, right?
No, couldn't have guessed, but I'm very blessed to be part of such an important mission.
Yeah. So are people spending money? Is that what we're doing here? What are they doing?
Well, Melissa can tell you.
Real quick, yeah.
Yeah, so we're running a mass media campaign. Our presentation at Brown was kind of the kickstart, and we're hoping to reach the general population, let you guys know how bad the situation truly is for women and children in Syria, why this hospital is so important. And we're going to have a telethon on May 20th, which is an hour-long fundraising event where we'll have doctors from Syria explaining the situation, people on the ground, local Syrians telling their stories, and we're going to be raising money that way. We also have a website where people can donate at any time, care4syriankids.com.
All right. By the way, all that information, go right to foxprovidence.com, and we'll have it there for you. You can click links to whatever you got to do to help. We'll see you again, hopefully in a more constructive fashion, but good to see you. Thanks so much.
Thank you.
And good work. What a story. We'll be right back. Please go to foxprovidence.com and see how you can help this this project in Syria. So much needs to be done there. It's incredible. Big week next week. Senate President Ruggiero will be here, and also make a note for Wednesday, former Governor Lincoln Chafee will be here. We'll see you Monday at 3 on the radio. Thanks for watching tonight. Have a great weekend. Good night.